Hello students and welcome to week 7 of HIM215. I had a conflict come up this evening, Thursday evening, so what I wanted to do was just give you a brief overview of this week's chapter, give you an opportunity to practice it, complete your quiz, and then we can reconvene this Saturday for some additional practice and some questions. But I certainly wanted to post this short video for you just so you had the opportunity to hear about some challenging questions and things to look for as you're working along. Okay, so I created the short video and I'm going to be switching back and forth between this PowerPoint and some of the resources that we have in the classroom for us. So let's begin. First, I want to point out to you some tricky items to watch out for this week. I've taken a look at both of your chapters and I've looked at some of the coding challenges that folks have worked on, and I tried to identify sort of the top things that people were having some challenges with. And certainly it's the modifiers. Do not forget your modifiers. And this is going to be very important for you as you are looking at things like left and right, maybe additional types of procedures. Remember, if we've altered the procedure in any way other than its original intention, we need to attach a modifier to that. And in some cases, some of you attached a modifier, but it might not be maybe the correct one. So we're going to look at a couple of those to make some determinations. Now remember, when we get into these types of things, you're going to be looking at positioning of like lesions. You're going to want to know the count of lesions, how many lesions are involved, what's the size of them, do they have margins? Do you remember way back when we talked about surgical margins? I mentioned to you that one of the important things for you to remember about margins is that when they remove a tumor, they will remove a tumor and take a little bit extra all around that tumor just to make sure that they've got it all. So they'll test the tumor for what kind of cell makeup it is, and then what they will also do is they will test the outside layer, that little bit extra, so that way they can determine if there's no evidence of disease or if there's no evidence of the lesion in that little bit extra, then they can determine that maybe they got it all. Okay, so keep in mind of that when you're going through some of these problems, that you are careful about that, because that can also throw you off. Make sure that you are paying attention to how many lesions there are, where they're located, and what the size of them is, because we need to account for those sizes. That's going to be very important for us. Make sure that if it's on the right or the left side, that you are capturing that. So if your code doesn't specifically say it, make sure that you've assigned the modifier. Also, be careful about placement. So if we're removing a lesion or a tumor, or we're doing some skin shavings on a particular part of the body, for instance, fingers, toes, arms, legs, knees, we want to be very specific. Now, when we get into hands and feet especially, there are, in some occasions, codes for like joint or which finger. So when you're looking at, do I assign right or left, or do I assign the finger, make sure you're reading the background of that. They have different words for the different fingers. So you might see something like grand finger, grand toe, those kinds of things. So make sure that you're sort of researching some of those as you're practicing. And when we come together to practice some of these, we'll take a look at some additional ones of those. I'd like to try to pull out and practice some of those if we can. Make sure that the code that you've picked covers all aspects of the code. So for instance, if you have a fine needle aspiration of a lesion on the third toe of the left foot, make sure that every part of the code that you've assigned, you can account for that. Okay, so you might only have left foot, but you might not have the third toe. So if there's some designation as to where it was or how many it was, etc., make sure you're accounting for that, because I've seen some folks doing some of those problems and missing out on that. So I want to make sure that students are aware. Again, watch your dimensions and account for all of the dimensions. Watch for the depth of the incision. And if you remember, the last time we met, we talked about, and the reason why I picked this picture is because this is a needle aspiration. And remember, we talked about looking at the angle of how they're using it. When we are doing a needle aspiration, we're just getting under the skin and we're aspirating, or we're pulling out a portion of it. So you'll see things like that for cysts or the like. They're still considered to be surgeries though. We're looking for fine needle aspirations under the surgery codes. So keep in mind of that. And make sure you understand the differences between scrapings, incisions, excisions, and aspirations, because they all look a little bit different as we're approaching it. So I want folks to make sure that they're clear on that. Also, here's some examples of where some modifiers might be confusing. Fine needle aspirations. For instance, a cyst of the right arm. What are the important things to know here? We certainly need to know the type, we need to know the location, and we need to further define. So those are areas that we need to be focused on. If we're looking at like shavings, keep in mind, if we're going to look at shavings of epidural lesions, for instance on the genitalia, if we have two lesions, lesion A is 1.1 centimeters and lesion B is 2.1 centimeters. So we need to make sure that as we're assigning codes that we take that into account. Now, if my designation for one code goes up to 1.0, then I need to account for that additional 0.1. Okay, I can't just say, hey, close enough and I'm good to go. So we're going to take a look at that here in a minute. Make sure that you understand an excision of an interdigital neuroma. Again, make sure you know your medical terminology here, because interdigital and a neuroma are significant when we're coding these types of things. And another area you're going to want to go back and make sure you review are things like open treatment. And in this example, we're thinking about an open treatment of a fracture of the right great toe, including external fixation. So here you have a modifier consideration. So make sure that you're focused on where is the location of this. Okay, so some people might want to use a right or an RT here. And while I am not saying that that's right or wrong, what I will say is focus in on the precise location, because even though it's on the right, they gave us another portion of this, and that is the right great toe. So those are going to be things that you're going to want to take a look at when you're here. There is a difference between the right and the right great toe. So when you're assigning codes, please make sure that you take those into consideration. Okay, and again, we're going to look at a few examples here in a minute. So let's meet this Saturday to practice some of these. I'd like to set up something for this Saturday at 10 a.m. to practice some extra problems from Chapter 7. So this is your opportunity to bring some questions, bring your coffee and let's talk about it. I will archive that as well so you can listen to it. But I wanted to at least give you the opportunity to have a little bit of guidance here, and also so that we can practice some additional ones, because these can get a little bit tricky. So let me end the PowerPoint now, and let's take a look at some of the considerations from your textbook, because these are going to be important. And the chapters that we're looking at in your textbook are chapters 37 and 38. Now, I would recommend, and I think we've talked about this before, that you download the PowerPoints for chapter 37 and chapter 38, because those will give you the details, and you're going to want to go through and highlight any areas that could be tricky, your modifiers, your different types of procedures. And I'm going to highlight some as we go through the chapter and page numbers that I'm going to want students to really make sure that as they're working on these codes that they understand these. Okay, so let's go into the Pearson text. And let me see about, yes, let me go in and go into the Pearson textbook. So I'm going to select our textbook here. And we're working on chapters 37 and 38. So again, I'm going to go and I'm going to point out some parts of chapter 37 that if you are working on some of these problems that you pay close attention to. Now, for those of you who may have already taken the quiz already prior to this recording, just remember that I do allow students to go back and retake one quiz between weeks 1 and 10. So if you find that this week was just your week to say, I lost it this week, that's okay. You just let me know as we get up to week 10, you still have a few more weeks yet, to let me know if this is the chapter that you would like to re-review. I certainly want to see students again. I want to see you understand the materials. So let's look at chapter 37. And in here, it's the integumentary system. So obviously we're looking at skin and, procedures associated with the skin. So you're going to look at fine needle aspirations. You may be looking at things that deal with cysts and lesions and the like. So these will cover the basics of the system, a coding overview, abstracting, what pieces am I concerned with, and we'll get into that shortly. Assigning codes for the integumentary system, what do those codes look like? How do I arrange those codes? And certainly if there's any E&M coding for dermatology. I'm not going to get into a whole lot of the dermatology coding, but I do want to point out a few important aspects of this chapter. So your basics, there's a lot of terms that go in here. So you're going to want to make sure that any of those terms that are here are things that you are familiar with. And one special note here that I will make sure that I highlight here, when coding for the integumentary system, you can have lesions that are described. Whoops, let me get this again. Lesions are described. I guess I got to go a little bit higher. There we go. By a single CPT varies from 1 to 15 depending on the type of the lesion and the method of removal. So you may have that information behind the code that's going to sort of determine if this includes one lesion, multiple lesions, and the sizing. So that's where we really want to pay close attention to that detail. Measurements. Now, when they're talking about measurements, one of the things that we're concerned with is what type of measurements we're taking. And the first focused one here that they have is called linear measurement, okay? And linear measurement identifies the distance between 2 points and is used to classify the length of a wound repair and the diameter, which is the distance from one side to the other of an excised lesion. Okay, so you're going to think about a linear measurement, and then you're going to think of an area measurement, which describes the space inside a boundary and is used to classify the amount of skin treated in a tissue repair or a skin graft. Okay, so when we're thinking about skin grafts, you want to be thinking about an area measurement. And usually in the pathology report, they will give you dimensions, and you'll be able to tell where the distance are because they will provide you with guidance. This is so many centimeters or millimeters from the center. Okay. So area is calculated as the length multiplied by the width of the affected tissue and is expressed in square centimeters. So you'll see that abbreviated as SQCM. Okay, so anytime you see SQCM, that means squared centimeters. Okay, so you're looking at an area, length times width. So I really like this picture here because for me, when I'm looking at these things, this helps me to sort of visualize it. So on page 687 in your book, your length or your linear measurement, linear, think of linear or line. I'm measuring the length of something, the distance between 2 points, point A and point B. Now my unit of measure when I'm thinking of linear measurement and length measurement is the linear centimeter, or just cm. So remember, 1 centimeter equals 0.39 inches, and 1 inch equals 2.54 centimeters. So if you have a code book, a CPT hardcover code book, this is someplace that in the procedures of the integumentary system, I like to write those definitions down just so when I'm coding these, I have a good working knowledge of what they mean. Okay, so your examples are 2 centimeters or 5.5 centimeters. So if you have 5.5 centimeters, you have something that's a little bit close to 2 inches. So if you think about 2 inches of a lesion, that's a pretty big lesion. Okay, but remember, these are expressed in centimeters. So the length of the wound or the diameter of a lesion are all things that we would apply potentially a linear measurement. And they may want to measure across it or diagonally across it, okay, to get the measurement. When we're looking at area, this is where we said we're going to measure the length times the width. This is used to measure the space inside of a boundary. Okay, so you have an example of a 6 centimeter in length and 2 centimeter in width. So it has an area, if we take the 6 times the 2 equals 12 squared centimeters. And that is the amount of skin that's damaged by a burn or repaired using a skin graft. So you're going to want to take a look at, you know, what are the lengths and the widths. And these are the things a lot of times that trip students up when they're looking at these things, not only when they're coding for a record, but maybe if you're coding on a quiz somewhere. So I would make sure that I understood the differences between these two and certainly how they're used. So let's move over to page 688, and I especially like this table right here, and I find it very useful for students, especially as you're learning about the different types of procedures in the integumentary system. This gives you the procedure name, it gives you the definition, and the reason performed. Now this will help you when you're looking at things like excisions, like incisions, autograft, adjacent transfer, or rearrangement, what they call ATT/R. Okay, and it gives you the reason why. So you might have cryotherapy, you might have destruction, you might have electrocauterization or electrical surgical destruction. All of those are done to remove lesions. Okay, flap transfers. So get yourself familiar with these. Now we see Moore's microsurgery. Your chapter here goes on to describe a little bit more in detail about a Moore's micrographic surgery. But this is a multi-stage procedure, and that's something that you're going to want to just keep in the back of your mind as you're looking to code this. And it's a multi-stage procedure in which a malignant lesion, which a malignant means that it's invasive, that it's spread, is excised in microscopic layers. So it's kind of a cutting away. They just don't go in and take the whole thing out. They have to cut it up into microscopic layers. Almost like sort of feeling like you're slicing something. Okay, the physician performs a procedure, also performs a pathological evaluation of each tissue layer. So do you remember when I told you about they do surgical margins? Well, this is similar, that when they have a lesion, they'll slice or remove a layer of it. Then they go to the pathologist and they look at it and they make a determination about it, and they might say, okay, we have to do some more. So then they go back in and they slice off some more and they take it to the pathology. And they do this until they don't find any more malignancy left. So we may slice and go to the pathologist. Pathologist says, yes, you still have some evidence of malignancy, so they will make another sort of layer that they'll take off, and then they go to the pathologist. And then when no further malignancy is found, the site is closed. Now sometimes they can do it right there in the right there is a procedure. The surgeon will do it, and the pathologist is very close. If not, that is something that is provided to the pathologist almost immediately, and those things can happen quickly. One of the other ones you're going to want to focus on for this week, especially for your quiz, are going to be things like shavings, okay, where they might remove an epidural or a skin or a little bit thicker down into the dermal lesion. And they use a sharp instrument in which to do that. It's kind of the shaving off of pieces. They're really not cutting into it. It's more of a removal of a layer, okay? And when they're doing that, they're looking for, trying to get in there to remove part of maybe a superficial lesion, okay? So tattooing is not going and getting your kid's name tattooed on there. This is a little bit different. This is the injection of a colored pigment into the skin. And some of the reasons they may do it is hide a discoloration caused by disease or congenital deformity, or maybe there was some sort of trauma. It can create color for an areola and nipple after a breast reconstruction. It can create color for eyebrows and eyelashes for patients with hair loss from cancer or from alopecia, which alopecia is the loss of hair. So there are different reasons for why they do medical tattooing. You're also going to want to look at something what we call wound repair. And this is intermediate. And we do this to clean and close deep wounds. So what they will do is they will go into a layered closure of one or more of the deeper layers of the subcutaneous tissue. And again, I would just go back and re-review some of the layers of skin. It's going to be super important for you as you're working with this, because you're going to need to know how deep or how far into the skin layers the procedure's going. So this is an excellent resource for you as you're going. So we had intermediate repair, and now you have simple and complex. So as we're looking at coding this, make sure that you're understanding the metrics, okay? Because these are categorized in metrics, not in inches or feet. So metric numbers less than 1 should be expressed with a 0 in front of the decimal, such as 0.25, to avoid potential confusion with a similar whole number such as 25. So you don't want to say 25 centimeters, because that can be confusing. So you're going to want to write it as 0.25, okay? And that will give you. So you want to make sure that you are understanding how things are expressed. So they give you some good comparisons here. Again, this would be something I may want to write my code book somewhere, just so I If I ever have to refer back to them when I'm coding something, I have them there. Summary of the phases of wound healing. This is something that you're going to want to look at. On page 689, they give you the Moore's micrographic surgery, and it talks about some of the things that I told you about, where they'll take the affected area, it's been numbed, then the surgeon goes in and removes visible pieces and the margin, that little bit extra. Okay, now note here, and again I'm going to highlight this as well. This margin is subdivided, put on slides, and examined microscopically by the surgeon or by the pathologist. Okay, so you want to just make sure that another layer is taken until they have no more of it detected. Okay, so those are important parts of the Moore surgery. So it's important that you have that because you're probably going to see that again somewhere. Now, when you look at burns, they have specific guidelines for burns. Okay, so you're going to want to look at this, and age of the patient matters here. So, and location of the burns. So you have certain percentages of the body that's been burned, and that's ultimately where they're going to be doing some adjacent tissue transfers. Remember that ATT/R that we talked about? Well, this is where some of those things come into play. So this will provide you with some good background on burns, burn evaluation, where the burns are, and how they go through and do skin grafts, full thickness, split thickness, again, all parts of how thick they're going through the levels of skin. This gives you your breast procedures, the different types of breast procedures that they do. Again, very important for you to sort of understand, you know, when they have flaps, when they have plastic reconstruction, okay, when what they're sort of doing. We've all sort of heard of mastectomies, but there's other types of breast types of surgery that they do that you're going to want to make sure you know. A lot of times people will use radical mastectomy, but there's also terms like simple complete, modified radical mastectomy, subcutaneous mastectomy. So there are little nuances for each one of these pieces that's going to be important for us to make sure we understand as we're coding these. Now, one of the areas I really want you to focus on, especially as you're looking at your quiz, are going to be the coding overview of your integumentary system. Now, I'm not telling you to ignore the rest of them, but I want you to spend some extra time here and work on some of these, some more of these as you're going, because again, you're going to see these. And in your guided practice, these give you some great examples of what you should be looking for. Things like squared centimeters, that's the area. Remember, we talked about that. Here is everything that's sort of involved. Defect area was 5 centimeters by 6 centimeters, needing a 30 square centimeter repair. How do we get the 30? We multiplied 5 times 6 because it's the area. And we know it's the area because it's squared centimeters. Okay, so those are all things you should be looking at. So when we're talking about abstracting these, make sure that when you're abstracting, you are going through each part of these. Now, you're going to want to make sure you know what a decubitus ulcer is, a pressure ulcer, and what the stages are. Okay, so he knows the diagnosis of, and make sure you have the stage 3, what the stage of it is, what it is, and where it's located, because you're going to need those for the code. All right. So let's look through, and again, this will give you surgical curement of 20 lesions. So we need to know how many, ranging in size from 2 to 6 centimeters. So that's going to be important when you're looking at this. You know, how many, and then what are the sizes of them. So you're going to want to account for the placement, you're going to want to account for the type of procedure, you're going to want to account for how many lesions, and you're going to want to account for the size of those lesions. So those are going to be important considerations as you're practicing. Now, assigning codes for the procedures, and this is where we're going to actually do one as we're talking. So one of the ones I want to go over for you is something that you'll see in your practice, and you may see something similar to this on your quiz. So I wanted to sort of go over this so that folks had an idea of what we're looking at here. Now, when we're going into the main term in the index and we're looking for shavings, you're going to want to look at skin first, okay? And then you're going to look at, in the main term for the procedure, such as excision, such as lesion, as selection, okay? So you're going to do skin, excision, and then what type of incision? It's a debridement, and then it's lesion. So is it benign or is it malignant? So this gives you the ranges of codes to go to, okay? So let's just take a look at this real quick. So what I'm going to do is I'm going to pull up what we call a click-a-code. This is from Find a Code. Now this is the same thing as what you have in your CPT manual, and you still have to do the same thing in the CPT manual. So if you use an encoder, you know, it just doesn't give you the answer. We're going to still have to do some looking around here. So I want to take the one that we did in our presentation. So let me pull that up real quick. Okay, I want to do shavings of an epidermal lesion of the genitalia. Lesion A was 1.1 and lesion B was 2.1. So I'm going to make a note of that, 1.1 centimeters and 2.1 centimeters. Okay, so let me see if I can sort of minimize that and move it over here so we can focus in on having it both here as well as being able to code. So let me see if I can move this over here for us. Whoops, got to be big. I may need to just leave it here. Okay, so let me move this over here. Okay, so it's telling us it's 1.1 and 2.1. So I went to my CPT, I looked up skin because they're epidermal lesions, they're on the skin. Okay, it tells me epidermal. I know that epidermal is, epi is upon, dermal is skin. So I know that I need to go to my site of skin. So I have typed in skin, and this brings me up to it. Okay, this will look similar to what your CPT will look like. Now, I'm going to look at this and I'm going to say it is of epidermal lesions of the genitalia. So I'm going to come in here and I'm going to look at, I'm doing shavings. So I want to look at shaving. Okay, so I have shavings here. And then I want to go to my site, genitalia. Okay, so this gives me my genitalia, it gives me my range of codes. Now here, this also gives me lesion 1, lesion 1, lesion 1, lesion 1. Now my lesions are greater than 2.0, right? I had one lesion that was 1.1 and one that was 2.1. So I'm going to want to make sure that when I'm doing this, that I am including my lesions, okay? So my first one is going to be 1.1 to 2.0, right? So my first lesion, so I'm going to click on the book here, and this is going to tell me okay, might be because I've got a lot of things running here. Let me see. So I'm going to pick this 11307. Okay, now keep in mind that when we pick the second one, we're also going to want to look for modifiers here, because you want to make sure that if we have anything, shaving of 2 epidural epidermal lesions on the genitalia. Lesion A was 1.1 and lesion B was 2.0. So we need to make sure that we capture both lesions and that we're using our modifier. Now I want you to think about and look through your modifiers and pick out which one you think might work with this and where I'm attaching it. And if you're not quite sure where to look about that, go back into your Pearson text in the chapter and it'll tell you when we need to use this. Now we need to use the modifier because we have two lesions, even though, okay, it says lesion 1, lesion 1, lesion 1, but we have two lesions, right? So there's no code here for two lesions. That's why we need a modifier. So what we're going to do is we're going to pick the dimensions that our lesions are. So the first lesion they told us was 1.1. So that one is not going to get the modifier because the code contains all the information that we need for that lesion. But we didn't get rid of just one lesion, we got rid of two. So the second one is 2.1. So the second one then falls on an 11,308. So we need to let somebody know who's looking at this that this wasn't really the first lesion, it was the second lesion, but we don't have any sort of code to assign for a second lesion. So what we're going to do is include 11,307 for the first lesion, that was 1.1, and 11,308 for the second lesion, that's over 2.0. But then we're going to attach a modifier on there of a 51. And the reason why we're doing that is we're letting them know that that was an additional procedure. It was done at the same time, but it was an additional removal of a lesion. Okay, so we want to make sure that when somebody picks this record up that they understand that we removed two lesions. We didn't have a code or any documentation behind the code in the CPT to let us know that there was more than one lesion. So what we did is we identified the first one because it fits in our criteria, and it was the very first one, and our record identifies lesion A, so that's the first one, and then lesion B would be 11,308 because it's over 2.0, and we would attach the modifier 51. Now this isn't the exact language that's on your quiz, so but be very focused on how many lesions do I have and what does my documentation say, because that's where your modifiers are going to come in. And if you're going to miss those points, it's going to be on those modifiers. Okay, so again, we have two lesions with this one. Our first one is 1.1. The second one is 2.1. But because our documentation says shaving skin lesion 1, what do we do with the second one? We can't just leave it off or do it and not say anything. We need to account for it. So we do 11301 for the first lesion and 11308 with a 51 for a modifier for the second lesion. And whether it's 2.1 or 2.9, 11,308 would be anything over or greater than 2.0 centimeters. Okay, so that is where you want to make sure. So if it's 3.8, that's what you're going to use. Okay, so just make sure. Now if my lesion was less than, like, let's say the first lesion was 0.4, then I would use 11,305. If my second lesion was, I don't know, 2.0, I would use 11307 with the 51. That modifier goes to the one that doesn't fit into this category. Okay, so that's what I really wanted to focus on with this session, was just getting you to think about how many lesions do I have, how big are they, and what does my documentation say? If I can't fit this, all my lesions or all of my dimensions within what's provided to me, then I need to go start to look at my modifiers and how do my modifiers help me get there. Now make sure, again, when you're looking at toes, like if they tell you the grand toe on the right side, make sure you're capturing the modifier for that. So maybe it's not RT for right, it might be, there might be a specific modifier for grand toe. So make sure that when you're reading these that you are accounting for each piece, because that can throw you off very easily. All right, so I'm going to close this up and I'm going to come back here. And again, take a look at your PowerPoint, take a look at the practice questions, and please email me between now and Saturday morning, let's say around 8, so I have time to prepare for our 10 o'clock live time. But that's the time to come with questions. Hey, I missed this one. What is the right answer, and how do I find it? Because that's where I want to give us the time to review those types of things so that you can understand how these codes work, because sometimes the nuances of the measurements and the area and the linear can be quite confusing. So I hope this has been helpful. Again, our practice time is on Saturday. I apologize. Like I said, I had a conflict with this evening, but I think this will work out for us very well to give us a time to do some practice. Have a great evening. Please let me know if I can help you, and I'll see you soon. Bye-bye.